Hi, my name is Muiris Houston and I'm a cardiology patient of the Galway Clinic, and I'm here to tell you what it was like to have a angiogram and to have a stent put in following that. So I was told that I'd have to have an angiogram done by the cardiologist, and I suppose I was a bit anxious about it, not having had one done before. But I needn't have been, because what happens is that you're fast from about midnight the night before and you arrive into the clinic. Mine was a morning session, so I came in at around 7:30 in the morning, and you go straight to a day ward where all the patients who are having the procedure done that morning gather, and each of us has an individual bed and we're looked after by a team of nurses. So you settle in there fairly quickly. They get you to go into one of these gowns, surgical gowns, take your clothes off, you jump into the bed, then they're around taking blood samples, and they usually do an ECG, and at that stage the thing kind of calms down a bit, to be honest, while you wait your turn to go into the cath lab itself. So you're sitting in a bed in a day room with a few other people and a good few nurses around, and there's a bit of chat and banter going on, and it's, to be honest, it's pretty relaxed and not in any way stressful. Yes, you can go home the same day if what you're having done is the angiogram. In other words, if it's a dye test and the test is to see whether there's a blockage or not. And if that's the case, you're allowed to go home a few hours after the procedure is finished. However, if you end up having a stent put in other words, if there's a blockage and they decide to unblock it on the same day, then you are admitted to the hospital up to the cardiology ward for an overnight stay, and then you can leave the next day, usually around lunchtime. Now, the one thing, whether you go home or whether you're staying, is pressure has to be kept on the wound area, because it's an artery. It needs a lot of pressure for a number of hours kept on it so that it doesn't open up and bleed again. So you'll have pressure bandages either in your groin or on your wrist, and you might be asked to keep some pressure on it even as you're travelling home. It goes without saying that you can't drive yourself home, so you'll have to organise someone to come and collect you, whether it's that evening or the next day if you've been kept in overnight. So afterwards, there's really no fuss. Once you've gone home, there's no need for any stitches to be taken out. They all dissolve themselves. You're going to be bruised for a couple of days, maybe up to a week, depending, but that will go down gradually over the week. You won't be playing any football, and you're not allowed to drive for about 3 days afterwards, and some people decide not to drive for a little bit longer than that. But basically, your next appointment is a routine appointment with the cardiologist, where you come in to see him in the clinic or in his consulting rooms, and the follow-up happens that way. So really, once you leave here, there's no big medical fuss. You have to mind the wound site a little bit, and you will have some bruising, but after that everything returns to normal quite quickly.